And joining us now is Dr. Benjamin Anderson. He's a surgeon, breast cancer specialist, and he leads the Global Breast Cancer Initiative for the World Health Organization. Thanks so much for joining us, Doctor. You know, there have been huge advances in treating cancer, but breast cancer remains one of the leading causes of death in women. Why is prevention such a key part of this equation?
Well, you're exactly right. Actually, breast cancer is now the most common cancer around the globe. And globally, it's the most likely reason a woman will die of cancer. Ideally, we want to prevent cancers, and there are certain risk factors that we can control. So weight control, exercise, avoiding excess use of alcohol, avoiding tobacco, both smoking and secondhand smoke. These are all things that would help. And there are many diseases that would be helped by controlling those sorts of risk factors. It is a limitation because actually, if you ask if we did all of the right things, what fraction of breast cancers would go away with those primary prevention strategies? It's maybe 20%. So that's why early detection followed by effective treatment is the necessary strategy, and that's what needs to be addressed in sub-Saharan Africa.
Well, you're talking about prevention there. Mammograms aren't usually recommended for women under 40, but the disease does affect young women. So should young women get mammograms, and if not, what should they do?
No, that would be a misconception. And that's actually, it's the high-income countries that have focused on mammographic screening. Where mammographic screening has been shown to be most effective is in women 50 to 65. There's a debate about its value in women in the 40s. And women, the incidence of breast cancer in those youngest age groups is such that mammography is not the right detection tool. And so actually, mammography is very expensive. You need to screen very large numbers of women to find those cancers. If you're talking about sub-Saharan Africa, the problem is these women come in with these very advanced tumors that you can see. You don't need an imaging study to detect it. So the first step is early diagnosis. That means coming in when symptoms are beginning, they're early, and we can diagnose the tumors when they're small rather than large or even ulcerated through the breast. That early diagnosis strategy is what we need to be focused on globally, and you have to do that before mammographic screening would be relevant.
So if young women are watching this, what would you suggest to them in terms of what they should do to prevent breast cancer?
Well, the first thing you have to do is be aware of your body. And so the idea of knowing what is normal, doing a self-exam, knowing what's normal for me that's actually a first step. And not everybody's comfortable with that, but I do think that that's very important because then if you notice a new finding, this is different, it's persisting, I've got a lump or I've got a thickening and this is not normal for me, that's when you need to come in for evaluation. Now, when women come in with lumps, are they all cancers? No, actually 9 out of 10 of them are benign, they're not cancer. So that's one of the systems we want to be working on in Africa and other low and middle income countries to make sure that a prompt diagnosis can be made, followed by effective treatment.
You're talking there about Africa. You mentioned Africa and lower income countries. How does breast cancer affect women in lower income countries when you look at the big picture compared with wealthier countries?
Well, it's a terrible problem, and it's time for us to start to work on it because now the majority of breast cancer cases and deaths are occurring in low and middle income countries. And by 2040, it's going to be 60% of the cases and 70% of the deaths. So that's why we need to build up these effective systems. Awareness and building the systems to receive these women is where we're focusing and using therapies that are sustainable and appropriate in those environments. But it does begin with a self-awareness and having access. Access is critical.
How much progress has been made with your initiative, in particular at the WHO?
Well, the initiative is new. We launched on International Women's Day, which was March 8th of this year. Huge progress has been made. So you heard the statistics earlier in the show. Actually, since 1990, there's been a 40% reduction in breast cancer mortality in these high-income countries. The question and the way we're focusing in the Global Breast Cancer Initiative is how do we translate those effective strategies that were done with tools that we consider standard today? How do we translate that into limited resource environments? And so effective health system strengthening is what we want to do. And we recognize when we improve outcomes with breast cancer, there are other cancers that will benefit similarly. In fact, other non-communicable diseases. This is about health systems that we need to strengthen.
Okay, we want to thank you, Dr. Benjamin Anderson. He's a surgeon, breast cancer specialist, and he leads the Global Breast Cancer Initiative for the WHO. Thanks so much for your thoughts on this very important issue.
Thank you for having me.